Little bit of back to school and some topics regarding, if you have a kid that has maybe a special health concern as you are sending them back to school. Of course, you want to be comfortable with the fact that everything's going to be handled all right and that maybe the kid is set up to have conversations with the adults at school about what they might be going through. So we're bringing in our medical expert here on Live Impact News, Dr. Payal Kohli. Thank you so much for joining us today. Good to see you.
Thank you for having me. The summer has just flown by.
I know. I was just talking with a friend of mine just today about how I can't believe we're pretty much into August. Like we're well into August. It's getting underway at this point. And here in the Carolinas, we already have kids going back to school. In South Carolina, this is their second day of school at this point. And in North Carolina, soon we'll see a lot of districts do the same. And kind of as I alluded to, the fact that, there are some, measures you might be needing to take as a parent if you have a kid that has a special condition of note, maybe like asthma or allergies, as we're going to talk about today, where you might need to make sure that you're kind of dotting all your I's and crossing your T's when it comes to getting them back to school and making sure they're doing it safely. So I guess what would you recommend parents do if you have a kid that has allergies or asthma, just to kind of set the table for a successful year, if you will, and a safe year for that child?
It's really important for the parents to actually plan it out, because asthma and allergies are one of those conditions that are life-threatening, where literally you have seconds to minutes to act. And so having preparedness ahead of time and an action plan in place, I think, is really important. So I tell parents to get prepared for back to school for what we call the September spike, which is where you'll see more asthma and allergies happening in September. You basically want to make sure their vaccinations are up to date. So taking a trip to the pediatrician or the doctor just to make sure they don't need any kind of respiratory vaccinations, flu or COVID or what have you. That's the most important step. Next, I would say have what's called an allergy or asthma preparedness plan. And for younger kids, I actually recommend that parents write it out and tape it on the inside of their binder or put it in their backpack, and then meet with the teachers and the school nurse and show them where it is. Because you can imagine young kids have trouble articulating or speaking that they have allergies, they're not feeling well. So it's really up to the teacher to recognize those signs and symptoms. And what that plan includes is what they're allergic to, what triggers their asthma or their allergies, what signs or symptoms they might manifest, because you can imagine every kid reacts differently. Some will get hives, some will get swollen lips, some will just get coughing or wheezing. Some can have problems like nausea, vomiting. So you want to make sure that you put on the teacher's radar what to be looking out for, and then what to do. Is it just a Benadryl or antihistamine type of medicine? Is it an inhaler, or do you actually want to use an EpiPen, and what are the circumstances under which they want to use it? So having that plan in place and a trip to the doctor to make that plan, I think, is really, really helpful.
Well, and you mentioned inhalers and EpiPens. How should parents be getting those to the nurses, as needed, getting the prescriptions out to them? What sort of timeline would you even recommend as far as in advance of the school year to make sure that those items or information is getting to who it needs to get to?
Now's the time. So about 3 weeks at a time, you want to call your doctor, make sure you have refills, make sure you get enough of them, have it in the child's backpack, have it with the school nurse. Definitely 1 to 2 weeks before school starts, everything needs to be delivered. And if you've already delivered it before last year, another trip to the school nurse to make sure that nothing is expired. In addition, you probably want to meet with the nurse to fill out some paperwork, because you can authorize the nurse to administer medicines like Tylenol and ibuprofen and those other types of medicines that really need your permission, but they're over-the-counter medications, so that the school nurse knows exactly what your child's health conditions are and under what circumstances they're allowed to give those types of medicines. So it's a great time to reach out to the school and see if you can set up a meeting with the nurse. And like I said, for younger kids, even go ahead and meet with the teacher. For older kids, it's more about teaching them what their action plan should be.
Now, I heard you use the term September spike. I don't know if I'd ever heard of that before, but I think it kind of makes sense. What causes that? Is this a seasonal thing? Is this, just getting back into a routine and things are maybe a little bit off? Are you seeing new people and maybe, the more people you come into contact, the more possibilities you can be having a reaction?
Yes, and yes. So a little bit of everything. So our immune system gets a little bit lazy over the summer because we just don't see as many infections, respiratory infections. We spend more time outdoors. And so we tend to see more respiratory infections occurring September, October as the weather starts to get colder. Again, because the immune system's a bit out of shape, we could be a little more susceptible. As you mentioned, kids are getting together, coming from different environments and such. So that certainly facilitates the spread of infections. But there's even some theories that, allergens, dust, irritants, chemical chemical irritants and the changing seasons can all trigger asthma and allergies for kids. So it's a pretty well described phenomena for kids with allergies and asthma, where you tend to see more things happening in September. So you may even want to think about turning on up their preventive medications. If they take a preventive inhaler, or if they use any other medicines to keep their symptoms at bay, this may be a time to talk to their doctor about that as well.
Now, do you have any recommendations on, how to talk to kids or educate kids on how they can have conversations? Because I think about, anytime, even us sometimes as adults, when we try to have a medical conversation with someone, it's hard to describe maybe what you're experiencing symptoms wise. And even maybe as a kid, I can imagine it might be tough to speak up if you're like sitting at a lunch table and someone pulls up, a nut, if you're like you have a nut allergy and you're like, oh, do I say something? How do you have those conversations and educate kids?
It's really important. And I have a little niece who's 3 years old, and she has food allergies, and she's embarrassed of them. She doesn't like to talk about things she's allergic to. So the idea is to normalize it, to make it that it's an okay. Some kids have them, some kids don't. And what I encourage parents to do is actually role play at the dinner table. And so, when you're sitting down and having dinner as a family, just go through different scenarios. Okay, what would you say if, you saw a nut on the table, or if somebody handed you a candy bar with peanuts in it and, you're not supposed to have peanuts, or if you're not feeling well, how do you articulate those symptoms to someone, and really helping them to have the confidence that this is not complaining, it's not tattling, it's not being not a team player, it's actually being an advocate. And it's important for them to do that, because a lot of kids tend to minimize or sort of ignore their symptoms because they're embarrassed to speak up in a social setting in school, especially in the middle of the classroom or the lunchroom or what have you. So teaching them that that's an important thing to do for their health, and people will actually, congratulate them for that, not something to be embarrassed or ashamed of.
Yeah, and I guess on that note, what sort of symptoms would you say rises to the threshold where it's like, now we really need to be either saying something or doing something, whether it's a parent watching at home or a teacher who might need to know some signs, or even if you have a child who might be watching this and they're like, okay, this level is kind of okay, but we're up here now, and now this is when I need to say something. What would you recommend?
So I would say if you're having repeated coughing, that's usually a sign, first one of the earlier signs of asthma. If you're having trouble talking in long sentences without catching your breath, that's another early sign that your lungs are not functioning the way that they're supposed to. If you're wheezing, if you're having any kind of severe nausea, obviously incessant vomiting, but even a sense of doom, which can precede an allergic reaction where you just feel like something is about to go wrong. That usually happens before you have a severe allergic reaction. These are all the early signs. Then, of course, it's up to us, everybody around, to monitor for some of the later signs, which are your lips are turning blue, your fingernails are turning blue. That means the oxygen's not getting in. You're not able to get a single word out because you're just not moving any air. That's the sign of a severe asthma reaction. And then, of course, if you start to get hives, any swelling on your lips, an itchy throat, which then can start turn into tingling of the throat, trouble swallowing, you're starting to drool. These are later signs of an allergic reaction. So I would say at the earliest signs is the time to act. And, like I said, it's seconds to minutes. You want to grab that EpiPen and not hesitate to use it if you think you might be having an allergic reaction. Because worst case scenario, you get an extra dose of epinephrine. It's not great, but at least it's going to protect you. But if you wait to go to the school nurse and wait to call somebody for help and what have you, it could be too late for that person. And if they're not improving within 5 to 10 minutes, they may need a second dose. So some kids actually require 2 shots of an EpiPen, depending on the severity of the reaction. And some people can also have what's called a, delayed resurgence of anaphylaxis, which means their symptoms settle down and then a few hours later they can act up again. So it's really important to get them to the nurse right away, but use the medication if you're noticing any of those severe symptoms, because that person may be at the point where they can't talk anymore, they can't verbalize. And if they're a younger kid, they may not even know how to verbalize.
Yeah. And I think about, the importance too of just knowing the symptoms in general, whether you don't have an allergy that you know of at least, because, I've heard how over the years, sometimes you can actually develop an allergy to something that never bothered you before.
That's very true. In fact, as our immune system ages, and for women after menopause, it behaves differently. So certainly you can develop allergies in adulthood to things you never were allergic to before, because your immune system starts acting different and overreacting to something that it hadn't overreacted to before.
Dr. Cole, anything you want to leave us with on this topic before we wrap things up?
I would just say that we lose people, adults and children, to asthma and allergies every year. And that really shouldn't be happening because it's all about just being prepared. And it's just like, as a cardiologist, I say for CPR, you could save somebody's life. So even if you're, as you said, if you're not somebody who has allergies, just learning how to use an EpiPen, watching a quick little video, just so that if you're ever in a situation on an airplane or at school or at work or anywhere where someone's having an allergic reaction, they're not able to give themselves the EpiPen, you can really step in and you can save a life.
Some great advice, Dr. Coley. We really appreciate it. And we will see you next time here on Live Impact News.
Thanks so much for having me.